Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Aaron Morgenstein and Corinne Sundar Rao. Aaron is an orthopedic surgeon. Corinne is an internal medicine physician. And together, they wrote the Kevin MD article, "It's time for the C-suite to contract directly with physicians for part-time work." Aaron and Corinne, welcome back to the show.
Hey, thank you so much.
So both of you have been on the show before. Go to kevinmd.com/podcast. In the upper right-hand corner, there's a little search icon. You can search for their names to hear their stories. But today I want to jump right into your article. It's time for the C-suite to contract directly with physicians for part-time work. So Aaron, how did this particular article come together?
Yeah, so for those who know me, I have a passion to help physicians find opportunities that are best for them. And sometimes the hospitals or healthcare system itself do not always present the best opportunities for these physicians. And so I got this great opportunity to go out to South Carolina, Charleston, and I gave a talk to the Carolinas Physician Services, which is the CAPS organization, which is a arm of the National Physician Recruiter Organization. And in preparing that talk and preparing that PowerPoint, I actually had Corinne edit review that talk. And the talk was well received. And then afterwards, Corinne had the good idea to say, hey, we should turn this into a little article and submit it to Kevin MD. And we did just that.
All right. So Aaron, tell me about the landscape when it comes to jobs not fitting what physicians may be looking for today.
I think we have a trend of physicians, particularly younger physicians, that are looking for something different. Now, unfortunately, I hear there's either employed jobs or nothing at all. And I think that we need to start looking at positions out there for physicians, especially the younger generation, where maybe they're part-time or less than full-time. And these new opportunities hopefully match the work-life balance that physicians are looking for these days and match the well-being of the physician and healthcare services.
So Aaron, you're an orthopedic surgeon. Corinne, you're an internal medicine physician. So Corinne, tell us what you're seeing in your world of internal medicine in terms of what physicians may be looking for and what common employers are offering.
So, Kevin, what I'm seeing is that physicians are looking for something that's not completely like a full-time employed position, some variation of the above. And, it seemed to be that it was only full-time employed or locums and nothing in between. However, we know that's not true. And Aaron and I have explored this quite a bit. There is flexibility to be found by, my favorite term is PRN or as needed positions. And you can actually put together a schedule that you like with a few different facilities. Now, facilities, on the other hand, seem to be somewhat either resistant to the idea or they're just not current enough to know that this is what most of the physician workforce is looking for. And I think that's what Aaron was speaking to.
And Corinne, what are some of the reasons why newer physicians are looking more towards part-time work?
So I think for one thing, the newer generation is more about work-life balance and more about flexibility and have other interests that they want to pursue. And then, Kevin, I think the burnout factor, it's always there. And part of the issue is that physicians are getting burnt out sooner into their careers.
And Corinne, just want to follow up on what you said earlier. The real two options traditionally would be full-time employment and locums. Now, for those who aren't familiar with the locums world, just tell us a little bit more about the locums option.
So the locums option, usually what happens is there are many locums companies nationally, locally, regionally, and they source jobs. Usually there could be a couple of other middlemen involved. And they post these jobs and physicians who are looking, they go to one of these companies or more and say, this is what I want. And they are presented to facilities after they look at, positions that may be available temporarily to fill. So that's how that works. And the locums company arranges your compensation and they keep their cut out of it. Usually travel, etc., is paid, and the locums company covers your malpractice. So that's how that works.
All right. So, Aaron, as more and more physicians are looking for part-time employment, how are employers feeling about that?
I think you see a mixed bag of healthcare systems and administrators and C-suites opening up to this idea. To me, it's a bit foolish for these healthcare systems to spend ungodly amounts of money for staffing agencies. Those can be locums companies, they can be some of these private management companies, some of them even backed by private equity. And to me, I'm at a loss of words why they wouldn't want to hire someone on a part-time basis, especially if they're struggling to recruit and retain physicians at their facilities. So I think there's a lot to it.
So, Aaron, when you talk to these facilities and you sense a little bit about that reluctance to contract with physicians directly part-time, what are the reasons behind that, if it makes so much sense?
So I think one is these hospitals have relationships with those locums companies or these private management companies, the contracts that are truly unfair to their healthcare systems and truly unfair to physicians that are actually providing those services. I think the second thing is that I think that the healthcare system doesn't fully understand or has not updated themselves on recent Stark Law revisions. And I believe, and I'm no lawyer, so speak to a lawyer or a legal representative, and to understand these Stark Law revisions to state that you can contract directly with physicians, you can pay them fairly, and you do not need a middleman to pay them fairly.
And Aaron, when we talk about part-time work, let's make sure we're all on the same page. What exactly do you mean by that from a physician standpoint?
Yeah, so like I said earlier, for me, it's either full-time or part-time, and part-time can be anything. So it can be a physician that works 1 to 2 days a week. It can be someone that works 1 to 2 weeks a month. It could be someone that just does weekend coverage. It could be someone that says, you know what, I got to take my kids to school at 8:30 and I got to pick them up at 3. So I can work from 9 a.m. to 3 p.m. every day. And so instead of having a traditional work model of, let's say, an 8-hour clinic, we shorten that just to get you in and have a 6-hour work clinic so that you can still spend time with your kids and your family.
All right, and let's talk more about that solution. So, Corinne, the scenario that Aaron presented about that work-life balance and sometimes life gets in the way, it's not always congruent, right, with a traditional employment model. So, if I'm a physician and I'm listening to both of you right now, and obviously that has a certain appeal, other than locums, tell me what some of the next steps that I should be considering.
So, Kevin, there's different ways to go about this. Use your network. That's something that we always say. Use your network to source opportunities around you, and try to connect directly with the facilities and see where that gets you. And be kind of persistent about it, because sometimes they may not have a need right then, but they might down the line. So you can just connect with them that way. What's important is that it's really alluring. It's very enticing to think of being the author of your schedule. And to me, like, I feel like I just can't go back to a traditional model because I just enjoy being able to get time off when I want to and curate my own schedule. So it's definitely doable, but it does take some work.
Kevin,
So,
if I can add one other thing to that, I think that as physicians, we go online and we don't need to mention those third-party sources that source out jobs and list full-time jobs. But the majority of jobs that are being posted are for full-time employment. And those are great opportunities to call those facilities and say, hey, I'm not interested in 5 days a week. Could we do 4 days a week? And I think there's something to negotiating. Say, hey, I want to work for you. I like the community where you're at. I would like to be a part of it. But because of this or that, can we change the job description? Can we work 2 days a week? Can I work 10-hour shifts instead of 8 hours? Can I do 10 days off? Whatever it be. But there needs to be a negotiation. And so physicians should not be afraid to call and speak with the facilities directly, understanding that many times the in-house physician recruiters cannot change the job description. So in some instances, you may want to ask to speak with the chief medical officer or maybe the CEO. Really depends on the size of the facility or the size of the healthcare system.
So I'm going to ask each of you for a success story. So, Corinne, I'm going to ask you, perhaps from the world of internal medicine, and Aaron, perhaps you could share a story from a surgical subspecialty where this is actually successful in action. So, Corinne, why don't you go first? Tell us a success story where you've heard of a physician in internal medicine reach out directly to an institution to create a schedule that's really amenable to them. So, tell us a story.
So I know of a physician that was nearing retirement and just didn't want to do the full-time grind and actually moved to this somewhat of a resort area and discovered that, they have some needs in the outpatient side. They don't have that many physicians. And basically just approached the local hospital, which is not a big health system, and said, I moved here. I'm kind of retired, but I wouldn't mind helping you guys and covering, your clinic a couple of days a week, or let's see how that goes. And he was actually able to get a really good deal for himself, and he was enjoying what he was doing because it was completely flexible and part time. And the hospital got what they needed, which was coverage. So that was one that was really something that worked out very well for both parties involved.
And Aaron, tell us a success story, perhaps from the surgical subspecialty perspective.
Yeah, if I could, I'm going to share two stories. One is of a surgeon that is nearing 70 years old. He quit his private practice after 30 years, but still loves medicine, still loves doing surgery. And so he started what I would refer to as a stage retirement. He reached out to hospitals and said, hey, I still have the skill to provide services. Is there any way we can work out a deal? Instead of working every day as a private practice physician, he now works about 1 to 2 weeks a month. He's very happy in his stage retirement, and he's making decent money doing so. And he's still in the game. I'll share another story about not a surgeon, but a younger physician, recently graduated hem-oncology fellowship. They believe their priority is to take care of the family and to take care of the kids. Well, she reached out to private practices and hospitals locally and was able to find opportunities for her to just work several weekends a month rather than having to work a normal traditional full-time employed job, because she didn't want to take a normal Monday through Friday hem-oncology position because she was more concerned about treating and being there for her family.
So, Aaron, from the clinician standpoint, the options directly contracting with these facilities for part-time work versus locums, from the clinician standpoint, contrast those two scenarios. What are the pros and cons of each? Because it sounds like from at least the clinician standpoint, locums isn't the more expensive option. So just tell us about those two scenarios that physicians are confronted with.
I think physicians want autonomy, they want flexibility, but they also want some degree of job security.
Okay.
I think that if you're going through a middleman, like a locums company, one of these private management companies, you don't necessarily have that job security. You never know when the hospital is going to hire someone else to take over. And so I think that if you really wanted some degree of job security, you speak directly with these facilities to figure it out. Now, if you're a physician that wants to bounce around, go from hospital to hospital, state to state, then maybe working with agencies is best for you. But I'm not going to say that that's best for those facilities, as we know they are very, very expensive to the system.
And Corinne, is this something that physicians can do themselves? I know both of you offer consulting services to help physicians, but is this something that they need a little bit more guidance with when it comes to reaching out to these institutions directly?
I think they do. I think there are physicians who want to do this, but they just don't know where to start. And the best thing they can do is educate themselves about the various aspects of contracting, legal stuff, malpractice, etc. The worst you can do is reach out and when you're uninformed, because then you simply don't know what to negotiate. So there are physicians who definitely want to do this, they just don't know where to start. So I think it's kind of like something that's undercover. You don't really hear about it, but you're hearing about it more and more now as people are discovering it. And I think it's doable for sure. Absolutely, it's doable.
So, Corinne, just want to follow up. Tell us some of those issues or concerns that that aren't immediately obvious when it comes to these part-time direct contracting arrangements?
For one thing, Kevin, may not know who to reach out to, and they might be, not being able to get anywhere. Like Aaron said, you might be stuck with an in-house recruiter who may or may not be able to change anything with the job description, or you might just not be getting through to anybody. So that's one thing. I think the second most important thing is it's hard to source these jobs because locums jobs are posted and you can find them. But to find somebody who would need you and be able to directly contract, it's harder to find. And I think that's where, again, contacts with other colleagues, networking, using the physician online spaces is all going to be helpful.
And Aaron, are you noticing any trends among medical institutions and hospitals that engage in part-time direct contracting? Are they in urban versus rural areas? Are they academic versus private practice? Any trends that you notice?
I would say if I'm seeing trends, they're very small. I am seeing those trends in rural communities, usually independent healthcare systems. So I always tell folks when I'm negotiating or when I'm giving advice to maybe not go after the largest healthcare system in your community, maybe go after smaller hospitals, go after critical access hospitals, folks that are probably more open to working an arrangement that works for both parties. I've seen a trend recently of private practices opening themselves up to contracting with physicians, independent contractors for part-time work. And to me, that's exciting that they're opening up to that. And so I think physicians need to know that when we're speaking about working part-time, we're speaking about working with healthcare systems and also with private practices.
We're talking to Aaron Morgenstein and Corinne Sundar Rao. Aaron is an orthopedic surgeon. Corinne is an internal medicine physician. They wrote the Kevin MD article, "It's time for the C-suite to contract directly with physicians for part-time work." Now I'm going to ask each of you just your take-home messages that you want to leave with the Kevin MD audience. Corinne, why don't you go first?
Kevin, the take-home message, there's two audiences for our article. One is the C-suite or the admins. And to them, I'm just going to say, encourage them to be open to the possibility of contracting directly because it may work out really well for them and probably cost less than paying middlemen. For the physicians, I'm just going to say, like I said before, educate yourself as much as possible, learn as much as possible, and don't give up. Just keep looking and you'll find something.
And Aaron, tell us some of your take-home messages, and maybe you could also just share some resources for physicians who just want to get started going down this pathway.
I think that physicians need to understand that starting new opportunities can be scary. I think that we are handed many things in our medical career. We're handed an opportunity to go to med school, we're handed an opportunity to go to residency, and then we're handed our first opportunity to be an employed physician or private practice. And it can be very difficult to take a jump to a new opportunity. Well, my recommendation to physicians is don't rely on third parties, don't rely on staffing agencies. Make the commitment to finding your next opportunity and start that today. Don't tell me that you're going to wait 2 years or a year until you're fully burned out. Start looking into it now. And when you're doing that, make sure you find mentors. Just like in residency, when we had mentors that advise us how to do surgery or treat the ICU patient, we need to make sure that we have mentors guiding us to finding new opportunities so that we don't get taken advantage of. And then we know that there's opportunities out there that match or align with what we're looking for. And that's what I kind of focus on when we speak with other physicians is educating them about how to negotiate. What are your deal breakers? What are the things you want to include in your contract? What do you want the arrangement to look like that works for you and for the facility? Is it a culture that you really want to be a part of? And other things like how is malpractice insurance going to get dealt with? And understanding the terms and concepts and clauses within a contract is so important when you start speaking with these facilities. It's important when you apply for your first job. It's really important when you try to go off on your own and create your own opportunities.
Aaron and Corinne, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.